I decided to be a part of the health fair here at Komotobu for the second year in a row because I enjoyed last year so much. I just I felt like we helped a lot of people. I also just felt like I learned a great deal, not only about different things in healthcare, but I also learned things about myself and things about other cultures, and I was just able to do something that I've been wanting to do for so many years, which was come over here. So I had to come second year in a row.
I am Joseph Maro. I was one of the attending clinical officers at IMABA, and I work in Arusha, Tanzania. The challenges of this exercise, about this exercise is lack of enough equipment and personnel. And equipment, I mean like medications. There are some medicines that we lack, like some combinations of drugs, we don't find them. It becomes a challenge attending certain conditions from patients. And personnel, most people in this area have realized suffer from optical issues. So next time if we find an optician, it will serve us well. But overall, it was a nice experience.
My name is Claro Babere. Yes, I come from around, and we have been organizing for this event for the this is the third year. We have been receiving these guests from the US, the doctors from the US, and we have seen a good work being done.
My name is Maya Johnson, and I am a registered nurse from the United States. I am from Tulsa, Oklahoma. I've been a nurse for about 18 years. The last 3 days, I started out a little nervous, definitely wanting to be able to help and hoping that I'd know how to step in and do this, kind of stepping into a different role of, kind of helping to realize what's really going on with patients. And as nurses in the United States, we don't diagnose or triage, so, we triage patients, we do. But definitely seeing the need that people need to be able to have more access to health care. The people have been so accepting and appreciative, being able to step in and hopefully help. I hope I definitely was able to do that.
Damara Aldridge. I'm a registered nurse from the U.S. I work in Atlanta, Georgia, downtown Atlanta, Georgia at Grady Memorial Hospital. And the reason I am at this health fair this year is because I had such a great experience last year in 2017 that I wanted to come back and do more. The reason why I chose this particular medical mission because there are so many that's going on right now in the United States where I have a lot of coworkers that do attend medical mission trips. But I chose this one because, first of all, I think that coming to Kenya is an awesome experience, and sometimes I think it's a once-in-a-lifetime experience. So when I was here last year, I thought we did so much great work. I wanted to just do more. So I decided to come back, and I plan to come back each year after.
My name is Charles Babere. I'm a native of Korea. Born and raised here in Korea, Kenya. Relocated sometime towards the late 1998 to the US. I am the founder and the CEO of IMABA. It's an organization that I started having worked in the community and having known the needs and the challenges that the courier people encounter. The purpose of IMABA is to meet the basic needs of the community, just primary health care, specifically or mainly education and prevention. So I think the biggest challenge we have is getting professionals, especially some specialty doctors. The main need I think now that we have is doctors like eye doctors that are specialized in eyes. We have seen patients with cataracts, patients with glaucoma and other eye infections. So hopefully we can get doctors willing to volunteer in those specialty areas or in that specialty area. We also need dentists. I saw several patients, even young kids with dental caries, who probably need more, and even others who needed dental decay that even needed some extraction. We do not have that service, but it seems like there is a very big need of a dentist or dental hygienist. So my hope is that as we proceed, as we continue forward as IMABA, is to appeal to friends and especially those categories of doctors. If we can get them joining us, that can be very helpful.